Hi guys, welcome back. We have another dermatologist reaction video, and we have Dr. Nina Desai here, board certified dermatologist at Manhattan Dermatology. Hi.
Hi.
So I'm really excited for you to be here for this one specifically. I'm excited all the time when you're here, but this one is a really, really good one because I think a lot of people are interested in this. It's Accutane. So we have Dawson. He is 17, and I actually love his enthusiasm. He tweeted at me. I think he like DM'd me, and he's like, I sent in my Accutane skincare routine because I couldn't find a good skincare routine when I started with the Accutanes. He's like, I wanted to share what I've discovered. So I want to see what you think of what he's discovered, and then we can discuss all of this too.
Yes, I'm super excited for this one as well because it's a really, useful, great medication, but it is important to be on the right skincare routine with it.
Agree. Is this common to see?
Yeah, so this is very typical of what we call nodulocystic acne, and this is the type of acne that's gonna leave those deep scars behind. He is an ideal candidate for Accutane because the issue here is happening at the actual sebaceous gland or the oil-producing gland. So you've got a combination of the oiliness on the skin, the P. acne bacteria, all the inflammation creating these deep cysts that are painful and leaving scars behind on the skin.
I think this is something that you've pointed out to me before. When people don't get on Accutane early enough, like he's 17, you would think like that might be too early to get on an oral treatment like this, but it's probably the best time because he's not going to get the scarring then, right?
Yeah, exactly. So in the right hands, you always want to discuss the issue of Accutane with your dermatologist because it is not for everybody. And there are some individuals that I would not put it on, but it really is something that you and your dermatologist will come to an understanding and an agreement whether you're a good candidate and whether you want to pursue Accutane. This is the perfect type of individual, so I'm really happy for him that he's going on this medication. There are a small percentage of people that actually will get worse before they get better when they go on the medication. So it is something that when you sign up for this, okay, I'm gonna be on this for, 5 to 6 months, maybe longer, and you will get good results, but you really got to follow the protocol.
Yeah, and that also includes a good skincare routine.
Absolutely.
When we say a good skincare routine, what are we trying to kind of consider, take into account?
So the most important thing about patients who are on Accutane is it's affecting the sebaceous gland or the oil producing glands. It's affecting those glands everywhere on the body. So you are going to get dry. Your skin is going to be really sensitive and really dry when you're on Accutane. And that includes not only, your facial skin, but your nose, so your mucous membranes, your lips, everything's gonna start feeling more dry and more chapped. So you're gonna be really, wanting to hydrate your skin so that you're not getting cracked and itchy and uncomfortable. So that's the biggest thing in terms of dealing with how to develop a good skincare routine when it comes to being on Accutane. So you can see he has these red, large, more cystic lesions that I'm sure if you were to ask him, he'd say a lot of them were painful at times, and then he does have the beginnings of some scarring. So you'll see this like kind of almost, we call them ice pick or divot scars on the skin, and then this redness that's left behind by the really inflamed acne.
So do you see a difference between males and females? Because I remember being in high school and stuff, and I had really good guy friends that had this kind of an issue happening with their skin, and I didn't have girlfriends necessarily that had this issue.
This can happen in both males and females, so I see it a lot in both, girls and boys, and it really doesn't have like a predilection for one gender versus the other.
Okay, so hormones aren't playing that much of an effect?
Hormones are playing an effect on your acne, of course, but females are having the similar hormonal issues than males are in terms of, the changes that they're going through.
Changes.
Yes, absolutely. So, nodulocystic acne is not something that's only going to happen, more commonly going to happen in men versus women. We see it in everybody.
Got it. And is there anything else that men or women should take into account? Like women probably have to go on birth control, right?
When you're on Accutane, the biggest thing for females is that Accutane is what we call pregnancy category X. So you don't want to get pregnant while on it because it can actually cause birth defects to a developing fetus. So there are a whole slew of, hoops that you will jump through with your dermatologist to make sure that you are on the right, medications, you're doing the right things, you're having the right precautions, all that kind of stuff. But yeah, you absolutely don't want to get pregnant while on the medication. That doesn't necessarily mean that you have to also be on a birth control pill. There are other forms, of being safe that we do discuss with our patients.
What is up? Suzanne and other dermatologists, how are you? My name is Dawson, and I'm 17, and I love this series so much, and I thought I would do it because there's no boys that did it, and most importantly, there's not an Accutane dermatologist and you reacting to the routine. So I thought I'd be the first, you know? And yeah, I really hope that you picked this video because I know there's so many people out there that like don't know what they're supposed to be doing when they're on Accutane. I really hope that this can help other people. So my skin is very oily and acne prone. Yeah, I just started Accutane like 3 weeks ago. Yeah, I'll insert a picture of how my skin was somewhere, how it's been basically like a long time, like months until now, until I'm on the Accutane. So yeah, I went to the dermatologist when I was first like 14, and I got on doxycycline. I was on doxycycline for 3 times, and so I'm pretty sure I got diagnosed with nodular acne, which to my believing it's like where like topical things won't work for your face, and that's very true for me because I feel like doxycycline works, but also for my skin it only worked for like a couple days and then it went back to really bad acne. So yeah, I was on that for 3 times and then I finally got on this past month. So yeah, so skin concerns, obviously like acne and oiliness are some of my skin concerns, my main skin concerns, I guess, and those are being dealt with as we speak with the Accutane. So also like post-inflammatory hyperpigmentation, like a lot on this side and this side. So recommendations, obviously I can't do it when I'm on the Accutane, but after it. Also like blackheads, I have a lot everywhere, like the mask area. We'll get into the products.
Dawson, this is going to be a very helpful video for not just for males that are on Accutane, but I think also for females that are on Accutane.
Absolutely, right? And also for individuals who don't know what medications they should be on, you know, don't know if it's time to see a dermatologist or not. He kind of hit the nail on the head where he said, you know, I tried the topical stuff. First he tried the over-the-counter stuff, the salicylic acids, the benzoyl peroxide. Then he tried the topical stuff. Then he tried the antibiotics. And then he's now on Accutane. So he's kind of telling us, you know, there are other options if, you know, you are not responding to the one you're already on.
That's what, it's doxycycline. I'm like, I feel like I've taken that before. It's antibiotic.
Yeah, doxycycline is the most common acne antibiotic.
That makes sense. And so all that's really doing is handling inflammation, right?
Well, a component of acne is the P. acne bacteria. So there isn't a bacterial component of acne. So you do want to have the antibiotic component to kill the acne bacteria, but yes, it's also anti-inflammatory.
Got it. Interesting. So that's why it was only working periodically for him.
Yeah, and you know, the nodulocystic acne, where I was mentioning that the issue tends to lie deeper at the level of the sebaceous gland, those are the patients that have that story. They say, you know, I was doing well, then I flared. And then I was doing well, and then I flared. So we say basically he's failed multiple rounds of antibiotics. So now he is definitely a good candidate for Accutane.
Okay, and then for women, how many rounds of antibiotics? And I ask this for women specifically because we know what happens when we go on antibiotics, right? Because we've got this stuff going on down here. So
so it really depends on the patient. Looking at him, seeing that nodulocystic acne from the first picture that he showed me, he's someone that I would discuss Accutane with off the bat. And if they're interested in it, that's what they would go on first. You know, so it really depends on what they look like.
Let's get into his actual routine.
Perfect.
This cleanser, CETAPHIL cleanser, I'm not too like crazy about it. It has like castor oil and fragrance in it, so it's normally stay far away from this, but everyone liked it when they're on Accutane, so that is one of them. And then so I do that morning, night, of course.
So he's using CETAPHIL, good old CETAPHIL.
Yes.
CETAPHIL has become very controversial. I mentioned CETAPHIL and people are like, they want to start freaking out on me and stuff like that. We've had Dr. Chu on the show as well, and she said that, you know, the reason why dermatologists recommend CETAPHIL is because they know it's not going to interact poorly with all of your treatments.
Yes.
Right?
So one of the reasons why it's recommended is because it's a non-soap gentle cleanser. So when you have patients who have inflammation or they have acne or they have eczema, you know, you want to make sure that they're not putting anything else on their face that might actually be making that problem worse. So it's not that it's actually helping, it's just that it's not creating any new issues for them.
Got it.
If you didn't have problem skin, if you weren't on Accutane, if you didn't have eczema, if you didn't have sensitive skin, we may want to go a different route in terms of which cleanser we choose.
That's good to know.
I don't dry my face completely because transepidermal water loss, yes. And then I don't dry it all the way, and then I put this on in the morning. I like that.
You know, Dawson, I caught that little nuance thing. You don't dry completely. So he makes sure his skin's a little bit damp still,
Yes.
and then he puts his lotion on.
Yes, because what that's doing is it's actually letting the moisture kind of stay on the skin and get absorbed back into the skin. He's picked CERAVE, which is a wonderful product line for patients on Accutane because it is very gentle. It also has ceramides in it. So what's happening with the skin barrier with Accutane is it's getting dry. It's getting compromised because of that dryness. So he wants to replenish that skin barrier, and the CERAVE is a great product line for that.
And we were laughing earlier because dermatologists love CeraVe because of the ceramides.
Yeah, absolutely.
Right?
Absolutely, because you'll find that patients who are really dry or really inflamed, the issue is not that they're not using the right moisturizers or heavy enough moisturizers. The issue is that the skin barrier is actually not intact. So that's why they're not getting the benefit of the products that they're using.
So do you think this is a great product for him on Accutane?
I think this is a great product for him on Accutane.
All right, let's keep going.
I really like all of CeraVe's products, or most of them. I think they're really good. No fragrance, no bull anything really. And then so after that, I do sunscreen, so it's only 3 steps to keep it really simple. So I like this. I've been using this for a long time. It's just a chemical-based sunscreen. I'm wearing it right now. I normally do it in the morning, and then to reapply, I like this CeraVe one, which I used this before Accutane, and this was way too oily, but now that the oil is kind of going down, I can start to use this again. And this is a combo sunscreen. This has a little zinc in it.
All right, so those are his sunscreens, and this is where I have the questions, right, about being on Accutane and then your sunscreen.
Yeah.
Sunscreens can be a little bit pore clogging. So what do you think of these 2 specific ones?
So he's actually picked 2 sunscreens that are what we call non-comedogenic. So that's the keyword that you're looking for when you're on Accutane or you have acne-prone skin. You're looking for the non-comedogenic sunscreens, which basically mean they're not going to cause congestion, they're not going to clog your pores. So I'm okay with the 2 sunscreens that he's using. I personally do have another favorite that I love for my patients on Accutane, and it's the Elta MD Clear. The reason I love that one is it's non-comedogenic, but it also has niacinamide in it. And niacinamide is a great vitamin to calm down inflammation. So whereas patients on Accutane or who have very sensitive skin, you don't want them on a lot of harsh ingredients, but niacinamide is actually really nice and calming for the skin.
That's good to know. So would he benefit maybe from adding a niacinamide serum to his routine?
He may. Again, with Accutane patients, it's all about what you can tolerate, and as long as it's not something that's too drying.
Got it. So maybe it'd be better if it's in that
the sunscreen,
because it's going to lower it a little bit.
Exactly.
Okay.
It's just a small concentration.
At nighttime, I basically just do the cleanser, don't dry my face all the way, and then put this stuff on. And I actually really like this. I thought it would be super heavy, and it kind of is, but when I wake up in the morning, my skin's not greasy. I think it just drinks this stuff up, so that's good. And I do use this under my eyes too.
I mean, that's one of my favorite moisturizers.
Perfect. It's perfect. So basically what he's doing is he's using a lotion, the CeraVe lotion, in the daytime because he doesn't want to feel like there's something heavy on his face. And he's using the cream at night where his skin can kind of, absorb it and repair and really take in that hydration. So he's doing it perfectly.
Yeah. So you hear that, Dawson? You're doing it perfectly.
Great job.
Yeah, I know. You can tell he's not excited. You're not excited about your skincare routine. I understand that, Dawson, but you're doing such a good job because you have to remember that skincare is an indulgence and it's about having fun and treating yourself as well. But in this case, he is literally treating his skin, not treating yourself. It's not treat yourself kind of day yet.
No, not yet. It will be.
It will be. And you're getting there. Yeah.
Last sunscreen, this is a new one. I really like this. This is a 100% physical sunscreen. So I've been trying to when I know I'm going to be outside and when I go on hikes and stuff, I definitely am trying to go more mineral sunscreen so it blocks it because hyperpigmentation is like probably my next biggest skin concern besides acne. So like when I am off the isotretinoin, like I don't want to have any of that anymore. So just trying to prevent it with this. And this is like 24% zinc oxide. So I really like this, and no fragrance, no bull crap.
I love it. He's like, no fragrance, no bull crap.
Yeah, he knows what he's looking for.
He does, definitely. What do you think about a mineral sunscreen for
So
someone?
I think that's fine. I think mineral sunscreens, when your skin is less sensitive, are going to be less irritating to the skin. So the one thing I have to tell Dawson is that he's only 3 weeks into his course of Accutane. So he's doing great on these products right now, but the skin is probably going to get more dry and more sensitive. So he really needs to make sure that he's staying up with his hydration. And there are other products that we can add in. There are some heavier moisturizers, heavier creams that I kind of point my Accutane patients in the direction of once, you know, they've kind of exhausted the simple over-the-counter stuff and they need something more hydrating. The other thing, Dawson, that you're going to notice is your lips are going to start to peel. Your lips are going to start to feel dry. So don't forget your lips and your nose. Your nose is going to start to feel dry too.
So what would be those other products?
So there are a few products that are physician grade. So there's a product called Hyalotopic Plus, which is a moisturizer. Again, it's like chock full of ceramide, so it's really going to help repair the skin barrier. There's a cream called Episerum. Episerum is a prescription cream, and that's a barrier repair cream. And they have a product for the lips as well. So it's all about repairing the skin barrier and protecting it while you're healing, while you're on the Accutane.
How about products that they can get over the counter if he maybe doesn't have access to these products or doesn't want to get them?
So another product that he could get, so the CERAVE cream is great because again, you're looking for that non-comedogenic. So you don't want to pick a moisturizer that's super heavy or thick and is comedogenic. The other one I really like is the NEUTROGENA Hydra Boost because that's a hyaluronic acid based moisturizer that's still, you know, light enough that it's not going to clog your pores, but it is going to be plumping and moisturizing for the skin.
Okay.
So keep it simple.
And yeah, we are at 6 minutes. I think I did pretty good. I probably talked really fast, but thank you so much. I would love to hear you guys' opinions. Yeah, thank you.
First off, 3 weeks. That's pretty amazing, the difference in his skin.
It really is. It works really, really well in a majority of patients. And I think I mentioned this before. There are some people that are going to get worse before they get better. So if you're not looking like this after 3 weeks, that does not mean it's not going to work for you. Again, it has to be the right person with the right medication. It's something you work very closely with your dermatologist to decide. But this is great. He's doing great.
He's doing great. So you brought up something really interesting, and I think about myself, right? Like if I were on Accutane and I started to get the peely lips, the dry skin and everything, I might be tempted to like try to exfoliate and do that kind of stuff. What do you think about that?
So with Accutane, when you're on Accutane, like I said, your barrier of your skin is definitely going to be compromised. So you have to be very careful with exfoliation. I actually don't have my patients exfoliate while they're on Accutane at all. The skin is drying, it's sloughing off itself. There's really no need to do anything more.
Okay.
That being said, for women, you have to be really careful with like waxing and shaving and things like that. Things that are actually going to irritate or pull on the skin. You have to be very careful.
Is there anything else people should know when they're on Accutane? Because, you know, he mentioned like he didn't really know what to do. He had to do a lot of research and stuff. So I'm sure there are a lot of other people trying to do research on this.
Yeah, absolutely. So Accutane is one of those medications that usually it takes me about 15 to 20 minutes to go through all the like potential things that could happen while you're on Accutane. So it is something that you really want to make sure you're understanding what this medication is doing, what it's for, what the potential side effects could be, so that you know, you're like, oh, okay, this is why this is happening, or this is why that's happening. But in terms of the skin, the basics are basically that the dryness is real. It happens to everybody. That's what it's supposed to do. So it does happen to everybody. And with these, you know, kind of gentle routines, you really can get through your course and you can do really, really well.
Could they add a humidifier to the room?
Yeah, for sure. You could add a cool mist humidifier, of course, because warm mist, you never want to breed any sort of bacteria with a warm mist humidifier. So always a cool mist humidifier. Anything that's going to help your skin feel, you know, hydrated. So cool showers instead of really hot showers. You know, that's also very helpful.
And then when they get off of the Accutane, is there the potential of going back on it?
So there is. There's a small percentage of people that do need to do repeat courses. There's a small percentage of people that do need to be on low dose Accutane, which we do, you know, for individuals who may, you know, just have that consistent breakout that, you know, just doesn't respond to anything else. So there's a lot of variation in what may happen after the Accutane course, but for the most part, a large percentage of people do very, very well. There is, you know, a need for some topical regimen afterwards. So that would be something we could definitely follow up with him once he's done with his Accutane course. He really does want to be on a good skincare routine that may include more active ingredients at that time. His skin is going to stay sensitive for a couple of months after the Accutane. So for that couple of months after the Accutane, he may be, just keeping it really simple. And then after that, you want to really work in those products that are going to help with any post-inflammatory hyperpigmentation, any congestion, and really help then kind of try to treat the issues that were left behind.
That makes sense. So you can't just, until you see how his skin does on this course of Accutane, you can't really say to him and then afterwards get on to something like this.
Yeah.
You have to see how his skin does.
Yeah, we're gonna see how his skin does. Sometimes the younger you are, the more likely you are to kind of have that oil resurgence in your body, but not for everybody. So we kind of just see how he does and then go from there.
But you're saying basically, because he might still be sensitive afterwards, to go slowly.
Go slowly. He will be sensitive afterwards, so we're just gonna go slowly with him. But once that sensitivity has kind of died down, we are, a good candidate for, like I said, some lasers to get rid of the redness, lasers to get rid of the scarring, some chemical peels down the road. So there's lots of things that you can do once you've completed the course of Accutane to really get rid of those, those nagging post-inflammatory issues.
Thank you so much, Dawson, for sending in this routine. I think it's really important for people to see this.
I think it's so important. Yeah, this is a real issue that a lot of teenagers and older individuals deal with. So it's really important.
I'm gonna leave information below so you can find Dr. Desai if you're ever in Manhattan Beach or in California and you want to see her. All of that will be in the description box below. There's also information if you want to send in your own skincare routine and have us react to it, because you never know if you might get chosen. Thank you so much again, Dr. Desai, for being here.
Thank you, Susan, so much for having me.
And we'll see you guys soon.
Bye.